For this afternoon, I will show you some issues and problems faced by workers in Cambodia before and during the spread of COVID-19. Next slide, please. In the textile and footwear industry in Cambodia in 2019, there are 1,153 factories with around 840,000 workers. Mostly are women. These women are migrants migrants from different provinces for work in the cities. Also, garment sector is very important. It remains the backbone of the national economy. 75% of the total export products come from the garment sector. The products manufactured and exported to they are exported to Europe, USA, Canada, Japan, and China. And in 2020, workers' wages are only $190 per month. Investors operating in Cambodia are from China, Hong Kong, Taiwan, United Kingdom, Japan, Malaysia, Singapore, and Korea. These products are being distributed to those large markets in these countries. The production chain of these products are involved with new brands, H&M, M&S, Adidas, Gap, Onavi, and Manigo, Salomon, and so on and so forth. However, I want to say that while we export products produced by our workers, they are part of our national economy. What is the working condition of our workers? Now I'm going to present to you about the situation of our workers' economy. These figures I'm presenting to you are derived from research on the truth of the national economic backbone and the Ministry of Labor and Vocational Training, and the impacts on the workers in the garment sector. Workers face very difficult working conditions. Workers' rights are not respected and protected. Managers or management of production line are Chinese. They manage the whole production chain. 80%, next slide please, 80% of the production in garment factories are based on short-term employment contracts. When it is time for the employment contract, the owners are discharged from legal responsibility before the law. Before the COVID-19 situation, they had our workers had difficult working conditions, but during the COVID-19, 180 garment factories were suspended, and these 180 factories are composed of 150,000 workers. They have lost their job. Some have job suspensions. They have no access to benefits. They have lost income. They need to find new job, and so on and so forth. While big companies suspend their activities and operations, there are subcontractors increasing. Next slide, please. And they put the banners to show they are recruiting workers, while the subcontractors use the materials from the big factories to produce the products for the big factories for production change. However, workers work at least 50 hours per week for the bigger or larger factories. The handicraft workers recruit and engage more workers in the employment through our survey. Large factories provide shirts or unfinished products to the subcontracting factories, and the workers in these factories have difficulty and lose their benefits. For example, they lose the access to National Social Security Fund. They do not get it. They work less days. They are paid on a daily basis. If they do not go to work, they would not be paid. For living conditions, those who produce for big brands are difficult. They live in rented room in small size. The rent fee is 25 US dollar, and the room they live in is hot, no ventilation. Usually and frequently they are sick. Their working and living environment causes health problems and risk to them. So 60% of our respondents said they are sick. 64% said they were sick, and they often went to private clinics near their rented house or rented room. Usually they spend their out-of-pocket money. They spend between 5 to 25 US dollar for medical treatment when they go to have health checkup at a private clinic. However, in their living space, 50.7% of them said they experienced having their room broken, so it is not safe in their rented room. Usually this happens during the daytime. When they come back from work, they experience this, and up to 50.7% of them experience this. During the spread of COVID-19, 88.4% said their daily expense are growing up while their income has been low, and they have lost their job or they have been laid off, and the most challenges include expenses on house rent, electricity, water, and food. Most workers use privately supplied water, which is costly. So, but the government supply water is cheaper, but the water price is higher if it is provided by the private sector. And now I would like to tell you who Women's Workers Center and how women how do they face their challenges. For Cambodian Women's Information Center, for Cambodian Workers Information Center, we work on our workers who face exploitation and injustice. So we organize them in their areas where they live to empower them. We want to advocate for respect for workers' rights. How we do our work is we have our drop-in center for workers to discuss about their working conditions, living conditions, and other worker-related issues. We want them to discuss about the situation they are facing. We want to ensure they discuss. We want them to have confidence in their leadership at both their workplace and at their living area. We want them to expose their issues to the public. We want them to access justice and social justice and social services provided by the states. However, during the lockdown due to the spread of COVID-19 in April and May 2021, a lot of infection occurred in the area where our workers live. They have faced a lot of serious problems. They did not have income, and the support from the government is limited. They cannot leave home to go to work. They were stressful. They lost income. They have no money to send to their children and back home to the village. They have no money to cover daily expenses for food and to repay loan and debt. However, in this even though this sector is very important, the government response and attention to this sector is limited. The government focus their attention on investors instead. For example, during the spread of the COVID-19, we asked for work suspension, but the government asked those factories involved to provide 50% of their wage. But later, employers said they could not afford to pay workers that much. They could afford to pay only 60%, and 60% the employers pay 40% and the government pay 20%. But they were paid $70 per month during the suspension. But the payment is not made in time to address the problems that our workers faced. Recently, we have heard a decision on promoting a wage to $194 per month for worker. This is my brief presentation. I look forward to further discussion. If you have questions or comments, thank you.